I acknowledge the partners and conference participants for coming together for this event to share experiences of health promotion during and beyond the COVID-19 pandemic. The pandemic disrupted lives, livelihoods, communities, and economies. We also know that it put health workers under extreme pressure. The conference objectives urge us to create synergies, build partnerships, and identify future actions that may contribute to policies. This conference, therefore, gives us an opportunity to reflect on some of the invaluable lessons we have learned as a country and as the world from the COVID-19 pandemic. It will also contribute to identifying sustainable practices that will build on our collective efforts of improving the well-being of our communities, especially vulnerable populations who have been impacted most. Today, we see encouraging signs of declining cases of COVID-19 globally, but we cannot forget the fragilities of our health system and the need to increase our resilience so that we can protect ourselves from potential disruptions that are still a reality. Pandemics such as COVID-19 can impede our efforts towards building a secure health system that brings our country closer to achieving universal health coverage. Central to this effort is to ensure that our most vulnerable communities, especially women and children, are protected, because even before the pandemic, inequalities of access have existed. These inequalities have been a key concern that have heightened the government's investment towards increasing health access for its populations. This is why it is critical that we share our lessons and learnings from this pandemic and align our recovery measures with long-term sustainable strategies. Most notable has been the important contribution of health promotion in tackling the challenge of the COVID-19 threat and its societal impact. Many of the containment measures that we adopted and relied upon to prevent the public and healthcare workers from getting infected and our health systems from being overwhelmed imply a change in behavior. Hand washing, wearing face masks, and social distancing are all forms of this change. In addition, health authorities have tried to enhance protective behavior amongst the public by issuing warnings and recommendations about this new virus. The victory of these measures provides impetus to turn the tools of health promotion for any future health crisis. Whereas we've made remarkable successes in the control of the spread of COVID-19, we're yet to achieve our vaccination target. The efficacy of the COVID-19 has determined that the vaccines increase our protection from the virus. We are not safe unless we are all vaccinated. Going forward, we must ensure that our health promotion efforts are inclusive. We must ensure that they enable our populations to have access to affordable health care, as well as have all the information that will help them determine their health outcomes. Health literacy efforts and multi-sectorial action that contribute to increase healthy behaviors are key lessons that are essential in safeguarding the public's health. Our health and well-being is indeed the prevailing concern that takes precedence over all other issues. The multiple dynamics we face in ensuring that we build a resilient and stronger health system remains a national priority. Our collective diverse knowledge provides significant opportunities that we can leverage to develop meaningful solutions to global health crises. Through clear communication based on health literacy, as well as through collaboration across countries, disciplines, health, and education systems. It's for this reason that I once again express my delight that this Health Promotion Conference is underlining the importance of promoting health during and beyond COVID-19. You all here have opportunity to contribute towards a better understanding of the world we currently live in and development of best practices towards promoting the health agenda in the coming future. It's therefore now my honor to declare this conference officially open. Thank you very much for your attention.
Your presence here today is a testimony of your commitment to the health sector in general and to health promotion in particular. We appreciate the various events and your participation and stewardship in different initiatives within the health sector, not forgetting, of course, the initiative Beyond Zero that has helped build on to the Linda Mama presidential project on ensuring that skilled deliveries do take place across the country. I'm certain you will find that health promotion is a worthy complement to your efforts in your health initiatives. The ministry indeed is committed to ensuring that all Kenyans receive quality health services, but also that diseases are prevented through empowering people to take charge of their health care. I think we've learned through the COVID-19 pandemic the role of individual responsibility when it comes to our health care. And so really, Your Excellency, today we are absolutely delighted to have you here. If I could scorecard you as you come to the end of your tenure, I would say each and every initiative that you've touched on is indeed touching on health promotion. From working with mothers, from working with children, from working on elements of nutrition, even the Beyond Zero Marathon that I have participated in and come last was a good initiative when it comes to health promotion.
Let me begin by expressing my appreciation to the Minister of Health and other partners, that is USAID, UNICEF, CDC, and WHO, for choosing to partner with Kenyatta University to promote health at a time when the world is recovering from the worst of the COVID-19 pandemic, which plunged the world into a crisis that has touched all sectors of our society. Due to the crisis occasioned by the pandemic, health promotion has become more important than ever before to support the health and well-being of people in our communities. Health promotion activities aimed at improving access to better information and services play a vital role in giving people more control over their health and well-being. Health promotion makes an essential contribution to fighting global pandemics such as COVID-19. In modern societies, new public health approaches are needed that can be adapted to local situations and local needs. As a core function of public health, health promotion supports governments, community, and individuals to cope with and address health challenges. This is accomplished by building health public policies, creating supportive environments, and strengthening community action and personal skills. As such, health promotion may paradoxically be more important in times of crisis than ever before. As a discipline within public health and a field of professional practice, health promotion contributes to addressing pandemic threats at different levels. Our chief guest, while everybody has a key role to play in the prevention and management of pandemics such as COVID-19, health promotion looks at a bigger picture to ensure people's well-being is not negatively affected by promotion messages and information that should actually help us to design better ways of doing this. Kenyatta University has been a part of the COVID-19 mitigation process by enforcing containment measures and vaccinating a large proportion of our population. The weekly webinars in COVID-19 organized by the Directorate of Health Services have been instrumental in creating awareness of COVID-19 preventive measures. In addition, Kenyatta University has focused on sports, games, music, and other recreational activities which are key in promoting wellness. I wish to assure you that Kenyatta University will always be ready to expand into new areas as part of our mandate to serve society as enunciated in our fundamental statements. At the end of the day, our responsibility as an institution is to serve community and our country in general by fostering excellence, training, research, and scholarship. In regard to promotion of health, we are committed to realization of the universal health care as part of the Big Four agenda and Vision 2030. In support of UHC, we release over 2,300 professionals into the health sector every year.
As a leading institution of higher learning, Kenyatta University prides itself as a hub of quality education, of service to the community, as well as research and innovation. It is with this in mind that the university launched the first Bachelor of Health Promotion program within the country. That takes us back tonight. Thank you. That takes us back to 2018. As a university, we have enjoyed a great past, contributing much to the history and legacy of this country. And we look forward to a future where we shall continue to do so in even greater ways. The time is ripe for us to begin reconceptualization of how health promotion will support the generation of health for current and future generations. Therefore, I wish to reiterate my support for the university's zeal and commitment in organizing this landmark conference on health promotion. I would also like to recognize and extend our warm appreciation to the partners who have made it to this conference. We recognize your commitment and your contribution. Many others have not shown, but we recognize them also. For some years now, promotion of health has been defined to include multidisciplinary disciplinary concerns, including social, economic, environmental processes, implying assisting communities, empowering communities to be significantly involved in their own health and in promoting their wellness, which can also be said to be fighting against disease.
Health promotion is not only about combating COVID-19. Kenya has prioritized universal health coverage as part of the Big Four agenda set by His Excellency the President. The aspiration is that all people in Kenya will be able to access, afford, and use the essential health services they need for their health and well-being. And again, health promotion is an essential enabler of this vision. Hence, it is very encouraging that this conference will take a wide view of health promotion and explore multiple themes, as has been mentioned before. As a UN family, we look forward to the increased prioritization of and investment in health promotion. What it will actually mean is that citizens of this country, of all ages, will know better how to take care of themselves, seek the right care at the right time, adopt healthier lifestyles, nourish themselves better, exercise, take up behaviors and habits which will lead to overall improved health, and hopefully a concomitant reduction of illness. So this is not just good for the individual, it is good for the country, it is good for the economy, and it is good for the development of Kenya. We also believe that health promotion has a wider role to play in supporting the foundation of society and can be extended to supporting positive parenting practices, positive gender roles, and also social cohesion. As I end, let us note that we have only 8 years left till 2030, the year that the world had aspired to reach the Sustainable Development Goals. And COVID-19, yes, has set us back. And collectively, we need to redouble our efforts, innovate, accelerate, and especially find ways to reach those who are being left behind. The United Nations in Kenya and our partners will continue to support the Ministry of Health, both nationally and at county level, to achieve Kenya's vision for the health for her population and also ambitiously pursue the SDGs. We believe collectively through this kind of collaboration and partnership, we can do more and we can do even better.